Hi everyone. So today's topic is hepatitis B serology. If you are confused about this topic, we will break it down from the scratch with simple timelines and real exam style examples. So let's start with the normal physiology of the hepatitis B virus. Once we understand this, everything will make sense automatically. So first of all, hepatitis B virus structure. The hepatitis B virus is composed of double-stranded DNA plus single-stranded DNA. Yes, it is composed of both types, double-stranded DNA and single. As you can see in the diagram, this part is double-stranded and this part is single-stranded. So it is partially double-stranded and partially single-stranded, as we can see. It has two serotypes, ADW and ADR. So we will remember as ADW. W stands for world. ADW is for world and ADR stands for India. In India, ADR serotype is found. There are A to J genotypes. There are multiple genotypes, out of which in India B and C genotypes are found. Please remember, out of which B and C are found in India. So let's come to the structure. Now there are multiple types of antigen. So this is HBe antigen. This is core antigen, HBc antigen. This is small surface protein, HBs, and this is large surface protein, HBs antigen. There is a medium surface also, and the core contains the DNA polymerase enzyme, and there is a lipid bilayer membrane, as you can all see in the diagram. Now let's move on to the antigens. As I have told you, there are three antigens, mainly HBs antigen, which is called as surface antigen, and please remember S for sick. Sick means it is present in infected persons. Next one is HBe antigen. HBe antigen stands for envelope antigen. E for E, envelope. So E is also stands for easy spread. So we can remember it is for active replication and high transmissibility. So it mainly acts as active replication and high transmissibility antigen. The last antigen is HBc antigen. HBc antigen is a core antigen. Core. It is clinically not detectable in blood because hepatocytes do not release this antigen. It is the antibodies of this antigen which are detected in the blood. Now we are coming to antibodies. Antibodies, first of all, this is anti-HBc. Anti-HBc is of two types, IgM and IgG. As we all know, IgM tells about the acute infection or the recent infection, and IgG tells about the past and the chronic infection. Second one is anti-HBe. Anti-HBe means end of spreading. The end of spreading suggests that there is low infectivity of the virus. If anti-HBe is present in the blood, it means the virus is of low infectivity. Now the third is anti-HBs. Anti-HBs states recovery plus immunity or immunity due to past infection or vaccination. If anti-HBs is present, we can say that the patient has recovered or patient has taken the vaccine or patient is immunized. So now let's talk about acute hepatitis timeline. So first of all, please see the HBs antigen. HBs antigen, it appears around week 4 and it peaks around week 12. Appears on week 4 and peaks around week 12. And it indicates the active infection. It disappears around week 24 if the infection resolves. Now the second one is HBe antigen. The HBe antigen, it appears soon after the HBs antigen and it indicates active viral replication, means high infectivity. It disappears as anti-HBe antibody forms from the blood. Now the symptoms, these overlap with the presence of HBe antigen and HBs antigen, generally between weeks 8 to 24. Now IgM anti-HBc. The IgM anti-HBc or the core antibody IgM, it appears around the week 12 and peaks near week 16. It is a marker of acute infection and disappears from the blood around week 28. Now total anti-HBc. What does this mean? Total anti-HBc, it represents both IgM and IgG antibodies to HBc antigen. It persists for life and it is a marker of past or current infection. Now anti-HBe. The anti-HBe, it appears after HBe antigen disappears. After HBe antigen disappears, anti-HBe appears. It indicates lower viral replication, means lower infectivity. Now anti-HBs. This anti-HBs appears in the last around week 32 to 36. It indicates recovery or vaccination-induced immunity. It also persists for lifelong in recovered or vaccinated individuals. Now, what is this window period? Window period is from 28 weeks to 32 weeks. Now, HBs antigen is gone, as we can see, but anti-HBs hasn't appeared yet. Only anti-HBc IgM is detectable in this window period. It is important to test anti-HBc to detect infection in this period. So, in the window period, anti-HBc IgM is the only detectable marker of acute infection. So please remember, in window period, anti-HBc IgM is the only detectable marker of acute infection. Now next one is chronic hepatitis. In the chronic hepatitis phase, the main important points to highlight is that there is HBs antigen. So let me change the marker. HBs antigen, it appears around the week 4 and stays for the acute phase up to 6 months. As we all know, up to 6 months, the phase is known as acute phase. If it persists beyond 6 months, it is an indicator of chronic hepatitis B. Now in this, we can see if it persists beyond the 6 months, that is 24 weeks. It continues. Now the dashed line, this is the dashed line, shows that in chronic cases, level may slowly wane over years, but not in all. Now HBe antigen, the HBe antigen in the above, it indicates active viral replication and high infectivity. As I told you earlier, it is also seen in acute phase and if persistent suggests chronic high replication stage. Now anti-HBe. Anti-HBe appears after HBe antigen disappears and it is the sign of loss of infectivity. In the chronic phase, appearance of anti-HBe suggests low viral replication. Now IgM anti-HBc. The IgM anti-HBc, it appears around week 8 to 28. Then it gradually falls off. It is seen in acute infection or flares of chronic infection. It is associated with symptoms like liver flares. Now, total anti-HBc. The total anti-HBc, it appears early and it persists for life. It remains in the up direction and it is a marker of past exposure, maybe acute or the chronic. It includes both IgM and IgG. Now, chronic hepatitis B, if HBs antigen and anti-HBc IgG persist beyond 6 months, it's chronic. I think you all got this point. IgM anti-HBc can reappear during flares. Anti-HBe may or may not appear depending on viral suppression. So I hope you all are clear about chronic hepatitis B. So now we will talk about stages of chronic hepatitis or the timeline of chronic hepatitis B. So as we can all see in this graph, focus on the upper portion. Now there are HBV DNA, HBs antigen, ALT, and this is the stage of the chronic hepatitis B. So in the phase 1, like stage 1, immune tolerant phase, the HBs antigen is positive. HBe antigen is also positive, as we can see. And HBV DNA, the load is very high. HBV DNA, the load is very high. And ALT remains normal. The liver damage is minimal or none. And in the old term, we called it as immune tolerant stage. But in the new term, we call it as HBe antigen positive chronic HBV infection. HBe positive chronic HBV infection. It is seen in young patients, especially infected perinatally. Now the second phase is immune reactive phase, HBe antigen positive. It is now called as HBe antigen positive chronic hepatitis B. Now in this, what happens? The HBs antigen remains positive. Okay, the HBe antigen is also positive. The HBV DNA is high. HBV DNA starts to decline, but it remains in the high levels. The ALT now starts to elevate. Yeah, ALT starts to elevate. The immune system is fighting, means liver inflammation begins. So liver cells will secrete the liver enzymes. Now this is called as HBe antigen positive chronic hepatitis B. Now this is the stage where seroconversion might happen, the loss of HBe antigen and appearance of anti-HBe antibodies. Now the third phase is inactive carrier. Now new terminology is HBe anti-negative chronic HBV infection. Now in this, HBs is positive. HBe now becomes negative. There is presence of anti-HBe antibody now. Anti-HBe comes in the picture. The HBV DNA loads decreases more, less than 2000 international unit per ml. The ALT now becomes normal. ALT comes normal. Virus is present, but not actively replicating. So that's why anti-HBe antibody is present and it indicates a low infectivity. Now let's talk about phase 4. Phase 4 in HBs antigen, that it remains positive. HBe antigen, it becomes negative. The HBV DNA is more than 2000 international unit per ml and ALT is elevated. This is called as HBe antigen negative chronic hepatitis. As anti-HBe antibodies are coming, so HBe antigen negative. Now new terminology is HBe antigen chronic hepatitis B. Now in phase 5 is the resolved HBV infection. In this, the HBs becomes negative, anti-HBs is positive, anti-HBc IgG is also positive, and HBV DNA is undetectable. ALT comes to normal levels. So this is called HBs antigen negative phase and resolved HBV infection. Now in this table we can see this is the summary of the things that I have told you just now. The phase is divided into HBe positive, HBe antigen negative, and HBs antigen negative. Chronic HBV infection, chronic hepatitis B, chronic HBV, chronic hepatitis B, and resolved HBV infection. So please go through this table. It is very helpful in the exam. Now let's come to the interpretation part of these all things that we have learned. Now in acute hepatitis B infection, the HBs antigen is positive, HBe positive, IgM is positive, anti-HBs is negative, anti-HBe is negative, and HBV DNA is highly positive, ALT is increased. So this is the early infection phase. Same way in the window period and the recovery period. The main difference is that in the window period only IgM anti-HBc antibodies detectable, and in the recovery phase the anti-HBs is positive as the patient is recovering. So anti-HBs antibodies comes in the blood. Now let's talk about the chronic hepatitis B. Chronic hepatitis B, the phases are immune tolerant, immune active, active, HBe antigen negative, inactive chronic phase, and the occult phase. So these all things are very, very important. Please go through this table and memorize these phases and whichever antigen and antibody is positive in which phase. So I hope it clears most of the doubts regarding HBV serology. If you have any doubt, please tell me in the comments. I will surely reply it. And to see more revision videos, please like, share, and subscribe the channel. Let's meet in the next video. Up till then, keep studying. All the best, guys, for NEET PG. Thank you.